Hi, welcome. I'm Dr. Pixie. Welcome. So today I'm going to be doing a cranial nerve examination on you. Yeah, because if I'm not mistaken, you had an injury around your left eye a while ago. Yep. Okay. So today I'm basically going to be testing whether your vision is still alright, and also I'm going to kind of be feeling around your eye, also with some Q-tips and like a brush, and seeing if you can feel everything properly, to test if your feeling around that area where you had the injury is completely back to normal. And I'm also, the eye vision test will just be me kind of looking into your eye with the light and doing a few simple tests like that to determine whether your vision is still the same as it should be. Okay. I also kind of saw that in your file. I don't know if there's anything else that I need to mention. Okay, so here it says that your vision the previous time that it wasn't a problem. Okay, I just want to like verify that, yeah. But yeah, here it also said that you did kind of have some feeling of numbness there. So the area kind of felt numb for a while, yeah. Okay, so that's something that I want to test, if it's still numb or if you can feel everything again. Okay, that's important that we can kind of test that, obviously. So yeah, and yeah, I think now we're just going to start with the examination. It's a very simple examination. It's nothing that should be painful. It shouldn't be too uncomfortable. It's just very like basic and simple. But if you experience any like extreme discomfort or pain during this examination, you should definitely tell me, because that obviously shouldn't normally happen. It can obviously be slightly uncomfortable, but normally there shouldn't be like huge discomfort during this. Okay, so I'm just gonna start. I'm gonna put on my gloves first of all, obviously. So yeah, and tell me, how did exactly happen, your injury? Oh, okay, so you play sports, yeah. Obviously during sports you can get accidents, yeah. Oh yeah, yeah, that seems very painful. But I'm glad that it's healing. It's definitely almost healed right now, yeah. That's great. Okay, so I'm first going to just start with the simple vision test. So I'm going to begin with just shine a light in your eye, and I'm kind of going to examine your eye and see what it looks like. I'm going to actually do this with both eyes, so I can kind of compare and see if they both look the same. So I think I'm just going to start with your healthy eye, so your right eye. Okay, so I'm just going to shine light in your eye, and I'm kind of going to look and see whether everything is alright. Okay, so let me see. Okay, can you please look up for me? Yeah, and look down. Okay, and look to the side. Yeah, and the other side. Okay, yeah, that definitely seems fine. Okay, that eye is obviously completely healthy, as it should be. There doesn't seem to be anything wrong with that, which is something that was to be expected. And now I'm obviously going to look at the eye that did have the injury. So yeah, this obviously, since she did have the injury, it might be slightly more painful, the light, like me shining the light in your eye. But yeah, it might kind of tear up a little bit more or something. Yeah, but I don't think it's going to be too uncomfortable, but let's see. Okay. Yep. Can you please look up? Yeah. Look down. Okay. And then look to the side. Yeah. And then the other side. Okay. And I'm also going to do with this eye. Can you please follow the light? With both your eyes, just look at it. Okay. Yep. Okay, I'm going to note that down. Okay. On your file. Okay, yeah, everything seems to be pretty much fine. I can kind of see in the eye that had an injury that there's like a few blood vessels that were kind of damaged. Yeah, you can already probably see yourself that you can have some redness in your eye. That's because some blood vessels are broken, but it's nothing big. The rest of your eye seems to be completely fine. Both your eyes follow the light properly, so there's nothing major. It's just the redness that you kind of have in your eye, but that's something that will obviously go away. Besides that, both your eyes are very healthy, so that's already a very good thing. And now I'm gonna just ask you to cover your right eye, and I'm gonna be holding up my pen, and I'm gonna ask you to follow it with your eye, and then I can tell if, just another time to check if your eye is working properly, but I don't think it will be a problem because with the light it seemed to be all alright. But okay, so cover your right eye and then just follow the pen. Okay, seems to be normal. I don't see any negative, I don't see anything bad, or yeah, your eye seems to be working fine, so I'm just also gonna write that down. Okay, you're doing really great. Okay, and so both your eyes are actually very healthy. They're both completely working fine. It's only the redness in that one eye that seems to be a little bit of an issue still, but obviously it's not really like hurting you anyway. Or does it feel painful or anything? No, okay. Yeah, it's a little bit annoying obviously, but it will go away after some time. Okay, but you're doing very wonderful to this point. So I'm gonna now test the feeling around your eye and see if you can feel everything. So if that area is being touched, I'm gonna check if you can feel it, and I'm also gonna check like both sides and see if you can feel it the same way. So I'm gonna just kind of be touching the area around your eyes, and I'm gonna be each time I'm gonna just with my both fingers touch an area, and I'm gonna ask you if it feels different. So I'm gonna be, for instance, touching it at the same space with my both fingers, and you have to tell if left or right feels any different. Okay, so does that feel different? Okay, feel the same? Okay, and here also feels the same. Okay, and there. Okay, so yeah, let me go over where the wound exactly was. Yeah. Okay, so it feels a little bit more numb still on that side. Okay. Okay, so on the left side of your eye, it feels a little bit more. You don't have the full feeling back yet. Okay. Yeah, I'm gonna do a few more tests with some other utensils as well, but I'm gonna already write that down. Okay. Okay, so it still feels slightly numb. Okay, yeah, but it's not like extremely numb. Does it just feel a little bit okay in some areas? Yeah. But I'm actually also gonna do this test again and kind of see if you can feel everything. I'm gonna do this with a Q-tip. Just kind of test this again. So I want you just to close your eyes, and then I'm gonna just put the Q-tip on a part of your face. It's gonna mostly be around that area where you had the injury, and I want you to tell me if you feel it. So every time I touch it, I want you to say yes, so that I know that you can feel it. Okay. Okay, so first time. Yes, okay. 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 That was a little numb. Okay. I'll write that down first. Okay. Okay, down here. Okay. 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 The area is also slightly numb. Okay. But you can feel it, but it's still a little bit. Okay. 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 So that was all fine, but it's just, yeah, this little portion over there. Yeah, that's slightly, okay, that's slightly numb. I'm gonna write that down as well, yeah. Okay, so overall it seems to be fine. Your vision is 100% okay. There's nothing wrong with that. There's no, it's 100% fine and like it should be. So both eyes are the same that way, but it's just a touch, the feeling of that portion of your eye that's still a little bit 100% okay, yeah. So a few portions are still a little bit, like this one portion of that injury, what the wound was, is still a little bit numb, yep. But, so I wrote it down, and you're probably going to have to do this test again in a few weeks, and then we're going to see if it's still numb, or if the feeling is coming back, you know. That's kind of what we want to test right now. So that's kind of why you're going to have to come back another time in a few weeks, normally. So it's to see if it progresses or if it stays numb, because or slightly numb, because that's kind of important, obviously. Okay. Yeah, thank you for coming in, and yeah, hopefully your eye will heal and hopefully the feeling will come back, but we'll see that in a few weeks. Okay, so I'll see you back in a few weeks. Bye.